Now we are on the second questions where we talk about breast cancer. What exactly are we talking about?
Okay, so breast cancer is a disease where some parts of the breast grow out of control and they grow really fast, faster than the normal breast tissue. And that's what can cause you to form a lump in the breast. So there are different kinds of breast cancer. The kinds of breast cancer that people get really depends on which part of the breast the lump forms in. So breast cancer can develop in the part of the breast that makes milk, or it can develop in the part of the breast that carries milk to the nipples. Um, and what type of cancer it is really depends. That what determines what kind of treatment you get. So when breast cancer starts, it's usually very small, some very small and only in the breast. And the lump can be so small that sometimes you may not even feel it yourself. And that's why when women get to a certain age,
Mm-hmm.
screening is recommended. And that screening um, includes both having your breast examined by
Okay.
the doctor
Mm-hmm.
and having some kind of pictures taken of the breast, like an X-ray, the mammograms that we're sponsoring this month, because you need those two things. Because some lumps are big enough
Mm-hmm.
for the woman to feel it herself or for the doctor to find it on the exam, but some of them are not big enough yet. And if you can catch it early with a special x-ray,
Mm-hmm.
then you're able to treat it before it spreads outside of the breast.
Okay. Thank you ever so much. So let us come back in studio to Ness Johnson. Ness Johnson, today we are discussing breast cancer awareness. What are the likely risk factors of breast cancer?
Thank you very much. The risk factors for breast cancer. Firstly, we talk about family history of breast cancer.
Mm-hmm.
The gene we have in the body, it
Mm-hmm.
might likely extend to another person in the family.
Mm-hmm.
So if that family, if somebody had died from breast cancer before in your family, the next person might likely come down with breast cancer
So
due
it's
to the gene.
genetic.
Yes, it's
Okay.
genetic.
Okay.
And then another cause of breast cancer is early menarche. You
Mm-hmm.
stopping your menstruation as soon as possible before the time you should stop your menstruation, and that time you stop your menstruation before that time. So it may likely come down with breast cancer. Excessive drunkenness. You drink more than 3 bottles a week. It helps to increase the estrogen level in the body. So for that reason, you will come down with breast cancer because when the estrogen level become very high in the breast, it
Mm-hmm.
will come down, it will make you to come down with breast cancer. Another cause here for breast cancer is non-parity. That is, you don't having children. Not having children at all from age 1 to the old age, you don't have any child. You might likely come down with breast cancer.
Okay.
Then late childbirth, you born your child at age above age 35, and
Mm-hmm.
you having your first child, you might likely come down for breast or with breast cancer.
Okay.
These are some of the risk
The
factors for
risk
breast
factor. Okay, and also
breast
smoking and
smoking.
alcohol. Okay.
Yes.
Okay. These are all the
Mhm.
like the risk factor of breast cancer. So you have to um please, the phone line is not open now. We're gonna go at least 30 minutes in the show before we open the phone line. Please stop calling. We'll open the phone line at least 20 to 25 minutes in the show. Then we'll open the phone line and hear our viewers which one of the questions they get for our studio guests, and also to share their view with us on breast cancer awareness month. Let us come back to Miss Buchanan. Miss Buchanan, clearly treatment of cancer is very costly. They have the reason for advocating for awareness is because maybe if we prevent it, we may not get to the point of having to spend humongously. But what is the level of breast cancer? From your opinion, what is your level of breast cancer in Liberia?
As far as breast cancer awareness.
Yeah,
Okay, well,
of breast cancer awareness in Liberia.
okay, well, what I can say is, from a personal aspect, I would say
Yeah.
that usually awareness is mostly around October,
Mm-hmm.
and it's not just in Liberia; it's around the world.
Yeah,
Just
it's a
because
global stuff.
exactly because October is Breast Cancer Awareness Month.
Mm-hmm.
However, one of the things that needs to happen, and that's why I'm happy with this campaign that we're doing, and all 7 of the associations that are in this particular campaign historically have been able to to continuously throughout the year do awareness and assistance for breast cancer. It's very important that regardless what the situation is now, that we use other months throughout the year, because breast cancer is not only occurring in October, it occurs every day.
Definitely.
Everywhere.
It's not a one-day disease.
Exactly. So awareness
life.
needs to be consistent,
Sure.
especially as this is the second killer of women in Liberia when
Definitely.
it comes to cancer, following cervical cancer.
All right, thank you ever so much. Next, Johnson, we come back to you. I really want you to do the demonstration of people doing their self-check. How can people do self-check when it comes to breast cancer? Because the figure in my introduction, I said more than 500,000 women globally are dying from this disease. So how bad is it in Liberia?
Breast cancer is very bad in Liberia because the people, they don't have the education about this breast cancer. Some of them, they receive the mass in their breast and they just feel that it is a wish. Some of them, they go to hospital, they just feel that when they buy medication from the drugstore or the pharmacy, it will help them. They don't go to hospital. They will start going from the clinic, from the drugstore to the clinic, from the clinic, and then when the mass spread now, the cancer spread before going to the hospital. And they think that somebody will perform magic. And this breast cancer business is no magic about it. It's better you come soon. When you come soon and be diagnosed of it, you will get better soon. But if you don't come soon and you stay, the mass already spread, it not made so before you go to hospital, there is no magic about this. This is why we are carrying on the awareness.
The early detection save life.
Yes, early detection is save life.
Definitely.
So how we carry on this awareness? We are telling people that each one teach one. When we teach you how to do your self-breast exam, you should be able to teach another person, because it is through this radio station our voices are going worldwide. But if we are in a community, we are not able to go worldwide from county to county, from village to village, even from community to community. It's only the surrounding area that the awareness is going. So if we have people that will carry us, each one teach one, at least it will help us to bring down this breast situation. So
yeah, you are just talking about self-examination.
Yes.
Can you just demonstrate that?
Yes, in doing a self-examination, every month, when your menstruation starts, within 3 to 5 days, you go in front of the mirror and then you stay, lift up your two hands and look at the nipple, your two nipple around the uvula. You will see, if you see any discoloration there, like the place is pink or one of the nipple is getting bigger than the other nipple, you go straight at the hospital to seek checkup. And then if you finish putting your hand up and see the evenness of your breast nipple and your breast, and then you put your two hands on your waist, and then you stay in front of the mirror, bringing your chest upward, and then to see the two breasts, to see whether they are even. So normally with a female, our breast, one of it is bigger than the other. But when you find out that one of the breasts is getting more bigger than the other and it's changing in color, you have to meet the hospital. Do not sit back and go to drugstore or pharmacy to buy medication. Go to the hospital and do your test to be diagnosed or to be treated. And next day, you have to put your left hand across your ear, your head, and then to your ear, the pinna of your ear, to expose the armpit. Where you will start the examination, you start to massage from the arm all the way down to the breast in a circular motion, not leaving any space undone. So you have to do it in a circular motion tenderly, and then as you rub it, and you will feel for mass in the breast. The mass is what we call the knot in the breast. So the knot here, the cancerous knot is not painful, but it looks like a banana peeling or it looks like the orange peeling. So if you rub it, it's sticking, it's not movable. So when you touch it, it's just sticking aside. And we have another mass in the breast, which is the entire the breast mass. Our breast mass itself, it has a mass in it. And then another mass can grow in the breast. It's movable. That one is painful. It's movable, but then it's painful because it move around and has small pain and round leg. That one, the medical people call it fibrotic mass. It can be removed. easily. But the cancer mass is just sticking one place. It cannot move. It cannot move from one place to another. So if you feel that knot in your tete, you have to go to the hospital directly, straight there to see how best the doctor can help you. And then when you do the first breast, the right breast, and then you go back to the left breast, and then you do the same thing as from under the armpit, from your arm all the way down, tenderly, and you come to the nipple, and then you squeeze the nipple. Sometimes you see the blood coming out of the nipple. Sometimes you see pus coming out. Sometimes you see clear fluid. Sometimes you see milky fluid. And if you have had your child or it's not breastfeeding, and water just coming from the titty, it's not normal. So you have to go to the hospital to seek doctor's advice.
Okay, so I just want you to make things clear. The cancer or not, it is painful or painless?
It's painless.
Okay. All right. Thank you so much. Thank you so much. If you're on our voice this morning and you want to be part of this all important program, you can call our Hot FM number 0770-107-107-0886. 107-107. If you're outside Liberia and you're monitoring us live on our Facebook or YouTube page, you can call our Hot FM WhatsApp number +231 880-571-223. That's our Hot FM WhatsApp number. So you can keep your calls coming in now. And as we dive into this life-saving information, let us come back to you, Ms. Buchanan. We know that there are so many advocates when it comes to breast cancer awareness issue. What are your institution doing?
Well, there's actually 7 of us in this campaign, as I said before.
Okay.
We have 2 clinical partners. Hope for Women, which is on A.B. Talbot Road, as well as Wellness Partners, which is on Congo Town Back Road.
Okay.
In addition, we have one charitable foundation, which is Susu Health Foundation. And in addition, we have 4 historically Black sororities.
Okay.
They're local chapters that are also working on this. So we are the Alpha Kappa Alpha Sorority Incorporated, the Eta Beta Omega chapter.
Okay.
We have the Delta Sigma Theta Sorority Incorporated. We have Zeta Phi Beta Sorority Incorporated, the Delta Iota Zeta chapter.
Okay.
And we have Sigma Gamma Rho Sorority Incorporated, the New Lambda Sigma chapter. In a nutshell, what we're trying to do is obviously we're trying to do awareness.
Okay.
And this awareness is not just flyers. We, as Nurse Johnson has said, actually going out into the community to bring this awareness to our people. Obviously, being on the radio now, talking about breast cancer is all about the awareness portion of it. But we don't just stop there. We're actually offering through Wellness Partners and Hope for Women free breast exams, which is very important. I really want to encourage all women and even men, because believe it or not, obviously men have breasts and they also get breast cancer. If you see something, you can go there and get a free breast exam this month in October. In addition to that, we are also doing fundraising to help the effort of allowing for free ultrasounds and mammograms.
Okay.
Obviously, those are things that are after you've done your breast exam. If there is a need for it, obviously, then you can then go to get those things done
Free of charge.
free of charge.
Okay.
Furthermore to that, because then obviously now you've gotten the diagnosis, and what happens after that? There is also some part of this campaign for treatment of those who have been discovered to either need further treatment or assistance with breast cancer. So awareness, free mammograms, ultrasounds, as well as treatment.
Treatment, definitely. You guys are doing extremely well, especially when it comes to, because treating cancer is not an easy cost. It's very expensive. So take advantage of the opportunity, free breast testing to these various locations. Hope for Women in
Wellness Partners.
Congo Town, right?
Congo Town.
Yeah, so you can take advantage of all of this opportunity. If you're on our break this morning, the numbers to call and be part of this all important program: 0770-107-0886-107-107. You can call and then be part of this all important program. Ask our studio guests, what do you want to know about breast cancer? Are you a breast cancer patient? You can call and share your experience as well. So the phone line is now open. Now let us come back to Nurse Johnson while we're waiting our caller, right? The cause of cancer. Oh, that question was actually for Nurse Johnson. How do people do their self exam? What do they look for? You just explained it, but I just want you to go over it, please.
They are looking for mass in the breast.
Painless mass.
Painless mass in the
So,
breast.
only female can come down with breast cancer.
Both male and female can come down with breast cancer.
Okay.
Yes. The male come down with breast cancer based on their family history of breast cancer.
So so I want to ask, you guys are doing free awareness, especially when it comes to testing and also mammogram tests. Are you receiving patients at your facility? Are people really turning out?
Yes, people are
Okay.
turning out, and then we are going into the community in the various marketplaces. We have been on the few days ago, and we are still carrying on the awareness. As today, people are on the field carrying on the awareness. So we are going on the awareness. But people, they have the mentality that when they come on the
Yes, I just
screening,
wanted to ask
they
you
are
the
thinking
feedback.
that they are thinking that we will diagnose them of having cancer, so they don't want to come, and then we tell them that they're having cancer, then they start to worry, and then they die. So for this reason, a lot of people are not coming for the screening.
Okay. So what are you doing towards that? And when people are trying to refuse, especially when it comes to breast cancer in Liberia, because I know when we have this awareness on World Mental Health Day, people believe that it is a wish, it is a village people. So they give all these myth comments towards it. So when people give that type of comment, what do you tell them?
Counseling session is best. So it's better if someone give that question, you continue that comment, you start to counsel them and talk to them that cancer is not a sickness that can kill.
Definitely.
It make them to understand that it can be treated. If even they are diagnosed of cancer, they will be treated. So
Okay.
you have to counsel them and see how best you can convince them to do the test.
Indeed, counseling is very important.
Yes.
So you have to. Early diagnosis is very good to save your life, and also take advantage of the opportunity. It's free, absolutely free of charge. Take advantage of the opportunity and know your status when it comes to breast cancer. So now let us join Dr. Smith. Dr. Smith, are you there?
Yes, I'm here.
So we just want you to tell us what is the impact of false diagnosis when it comes to breast cancer?
Okay, so to discuss false diagnosis, we'll talk about false positive, and then we'll talk about false negative, and I will explain what each one means. So a false positive test is, say, if your mammogram shows a lump, but it's not breast cancer.
Okay.
But that should not be a reason for people to not come get their mammogram, because like I explained in the beginning, there's different types of tissue in the breast. And we got the part that makes milk and the part that carry the milk where the breast cancer usually forms. But there's also the part that's almost like cement that holds everything together. And we don't usually see breast cancer form in that part, but you can still get a little knot in that area. So every knot in the breast is not cancer. So when we see a false positive, sometimes that means that the mammogram shows something that looks suspicious, but you maybe come back for another x-ray, or you have to do a biopsy procedure where the doctor takes a needle or cuts the skin to take a piece of the tissue to see whether or not it's cancer. So so that's the when we think about impact of false diagnosis, if the mammogram shows something that ends up not being cancer, then that means this person is going through more testing. They may be getting a biopsy. They're dealing with the cost, of all this testing. There's also a mental health impact because the person may be stressed out and very worried about potentially having cancer.
Sure.
But and sometimes that can cause women to delay getting their next mammogram, because if the last time they came, they had a false positive, they may not want to come back. So it's very important to educate women who have a false positive test about the importance of continuing to get your breast cancer screening, because just because that last knot they found in your breast was not cancer doesn't mean the next one will not be cancer. Then the other thing we can see is a false negative, and that's where the mammogram looks fine, but there's actually cancer hiding in the breast. That is more common in women who have very dense breasts. So
Okay.
women with dense breasts on the mammogram can be hard to see cancer because the cancer can hide in the breast tissue
Mhm.
because they have a lot of that cement part that I talked about. So it looks similar to the breast cancer.
Okay.
And and the impact of false negative is, it can delay treatment because people might have a false sense of security. Oh, I came, my breasts were fine. I don't need to keep screening. And again, people may not come back because, oh, it was already last year, so I don't need to come back this year.
Okay.
The false negative is more common in younger women because young women are more likely to have dense breasts.
Mhm.
So some of these cancers can be missed on mammogram, but sometimes it's easier to pick up on ultrasound, and that's why our clinical partners at Wellness Partners Health and Hope for Women International,
Mhm.
based on their judgment, based on the judgment of the doctor who is seeing the patient and examining them, they determine based on the patient's age and other factors whether or not the woman needs to get a mammogram or get an ultrasound.
Okay. All right. I just want you to just tell us how can we diagnose? How is the test done?
Which test? The
The,
mammogram?
yes, the mammogram and other stuff.
So I'll start with the ultrasound because that's the simple one. If anyone has ever had, maybe when they're pregnant, they have to get an ultrasound
Mm-hmm.
for the doctors to see the baby. It's the same thing.
Oh.
So they just take the little kind of stick that's attached to the machine and they rub it over the breast to take pictures.
Okay.
So the ultrasound is not invasive. It's not uncomfortable. It really doesn't cause any pain or anything like that. The mammogram, that's the one that can scare people because it can be uncomfortable. The
Mm-hmm.
mammogram machine, they basically squeeze each of your breasts one by one
Mm-hmm.
between the two pieces of the machine,
Yeah.
squeezing it so now you would feel that they're trying to squeeze all your titty juice out.
Mm-hmm.
I get my mammogram every year.
Oh, okay.
It doesn't hurt to the point where I would not get it because I scared of the test. It takes a few minutes and then it's done. And that's a few minutes that's uncomfortable. It might hurt just small, not even hurt to the point where it would make you cry.
Okay.
But just let somebody pinch you high and then they leave you alone. So
Mm-hmm.
it is definitely worth getting it. It's a special machine where it got to squeeze the breast and make it flat.
Okay.
As flat, and some people got big titties, so it can make it too flat now, but as flat
Mm-hmm.
as it can make it to get a very good picture of everything that's going on in there.
Okay.
But it really just takes a few minutes. And it's worth doing it because to run away from somebody pinching your breast lip here and end up with cancer that spread out of your body, out of the breast,
Mm-hmm.
it's not worth it.
Okay. Okay, that I'm going to dive into this more because I want for the public to really know about this whole breast cancer issue. I just want you to tell, is there stages of breast cancer?
Yes,
Okay.
there are stages of breast cancer.
Mm-hmm.
And usually, and this is the whole point of trying to
Mm-hmm.
get it early
Mm-hmm.
because you know, bre- all cancers in the body are based stage on a scale of 1, 2, 3, 4.
Mm-hmm.
Stage 1 is usually where the cancer is small and it's only in the breast.
Mm-hmm.
And as you go up that 1, 2, 3, 4 ladder, by the time you get to 4,
Mm-hmm.
it's already spread out of the breast. And when the cancer spread out of the breast,
Mm-hmm.
that's when you need more treatment. Besides surgery, you may need chemotherapy. And that's when the chances of dying from breast cancer gets higher. So
Mm-hmm.
the kind of simple way to look at it is stage 1, 2, 3, 4, and stage 1 is the one that we want to catch.
Mm-hmm. All right, thank you ever so much. If you're on our voice this morning, the numbers to call and be part of this our important program is 0770-107-107, Keep your call coming on our Hot FM number. Please stop calling my personal number because it's not connected to the studio. Okay, keep your calls coming on Hot FM number 0770-107-107, 0886-107-107, and be part of this all important discussion. So now come back to Les Johnson. Les Johnson, what are some of the activities you guys do at Hope for Women, especially when it comes to breast cancer awareness?
Well, we do screening
We
at
almost at the end of our questions, so I'm just creating questions to beat
yes.
up the 1 hour.
We do screening at Hope for Women International,
Good.
and we also serve chemotherapy
Mhm.
at Hope for Women International. And we do some testing at Hope for Women International,
Mhm.
like the KFT, the CBC. We do those testing at Hope for Women International.
Someone may be listening to you, maybe way in a county. Where is this Hope for Women located? How can they find this place?
Hope for Women is located on the AP Tower Road.
Okay.
The road from the ERWA Junction, the bypass going to Red Light, you use that road and you find AP Tower Road. The symbol is right there. It's on the Hope for Women International, and another symbol is there, bearing SGBV. When you get there, leaving from ERWA Junction side to go to Hope for Women is on the right, and leaving from Red Light to come to Hope for Women is on the left.
Okay. So how long you guys been doing this awareness, especially breast cancer awareness?
We've been doing this awareness since 2012.
Okay. All right. Thank you ever so much. Let us come back to Miss Buchanan. Miss Buchanan, we discussing breast cancer awareness, and you mentioned almost several of you, and you guys are in 3 other communities. I just want to know how long, what drive your passion to this?
Well, this is something, as I mentioned before, is that the second killer, highest killer of women in Liberia when it comes to cancer. So that alone should drive all of our passions, because we all, at some point in time, have known or will know somebody who has breast cancer. So, in a way to, like I said, honor the survivors, but also to remember those we lost, but to support, to make sure that this does not happen to other people. So that is our driving passion.
All right, Donna Smith, are you there?
Yes, I'm here.
Okay. Is there any other thing you want to discuss that we didn't talk about?
So just I really just want to reinforce what we already talked about. I think the important thing, Nurse Johnson did a really good job outlining what are the risk factors for women for breast cancer. So it's very important to know your risk. It's very important to know your own breast, know what your breasts look like, know what your breasts feel like. So if anything changes, you can catch it, because some women find their own breast cancer before the doctor finds it. So know your breast, maintain a healthy lifestyle. A lot of people don't know about the connection between alcohol use and breast cancer, but it's a true risk factor. So maintain a healthy lifestyle and know the warning signs of breast cancer. If you feel any lump or knot in your breast that wasn't there before, that's a warning sign. If you're not breastfeeding and you got water draining from your nipple, that's another one. If you know the shape and size of your breast and it start looking different, one of them looking bigger than the other, or the skin on your breast looking like orange skin, like the orange peeling, like all of those things are signs of breast cancer, and it's very important to know those signs so you can know if something's going on. But again, because breast cancer doesn't always have signs that we can see, it's important to do your screening. So that's why, especially for women age 40 years and older, it's important to do that exam with the doctor and get your pictures of the breast, your mammogram. Very important. So we are encouraging women who are listening to the program today to take advantage of the free screening program we're doing. This goes through the end of October. So the free breast exam and the mammogram or ultrasound for women who need ultrasound is through the 31st of this month.
Okay.
So please, if you need to be screened for breast cancer, take advantage of this program.
Is there any other awareness program on here?
Not at the moment, but stay tuned.
Okay, thank you so much. So thank you ever so much, Dr. Smith. Let's go back to this. Johnson, Nurse Johnson, is there any other things you want to discuss that we didn't talk about?
Yes, we are appealing to the public to please come on this awareness. We should take advantage of this free breast cancer awareness. They are doing a mammogram to hospitals like Jamali. They are doing mammogram there free of charge with this Ottawa month. Let the women, the men, both men and women, they should come to do their awareness so they can be able to do their breast and their mammogram free. Anything concerning cancer and breast this month is free of charge. So I'm appealing to the public to please go to Hope for Women to do their breast exam so that they can get the free testing, and then to Effort Baptist Church will be there maybe on Saturday, and they should please come to Effort Baptist Church and will meet us there and will be carrying on free breast exam. So we'll call it Effort Baptist people. The day they will show will be there on that day.
Okay, since you are in contact with the community, how is the turnout like?
Actually, we are having a mass, a bigger phone that we're using around from market to market. But it's like the people don't even want to come for the screening because some of them they are making a remark saying that they don't want to be tested and then they be diagnosed of cancer and they start worrying till they die before their time. So we are managing, fighting hard and getting few people. Sometimes we go like 15, 16. The highest of persons we have getting in those marketplaces, the highest was 17. So we are currently asking our Liberian people to come. We are not telling them that they have breast cancer. We just want to check them. It's good to do your health checkup. To be healthy is better than to be passing around and you don't even know whether you are sick. And then when the cancer come now, it's come heavy, then you start to go to the hospital, it cause serious problem for you.
Okay, so I just want to know again, are you guys only in Masurado or are you guys trying to spread yourself out to the various counties?
Well, that we are trying to spread ourselves up to the various counties.
Yeah,
currently, discuss, yes.
Currently, you guys in Masurado.
Yeah, currently we are in Masurado.
So, Ms. Buchanan, is there any plan on going to the various county?
Definitely stay tuned for that. But one thing that I can say is, again, with our awareness that we're doing, it's not just going to be in Masurado that people are going to hear about this. So they have the opportunity to come, but we can definitely, that is something we can definitely work into to spread it out. Yeah.
Okay, thank you so much. If you're on our break this morning, we started to show you guys who are calling a lot. Now we open the phone line. Please keep your calls coming in. 0770-107-107-0886-107-107. You can keep your calls coming in. Ask our studio guests all of the stuff you want to know about breast cancer. Or better still, you can call and share your experience with us when it comes to breast cancer. Are you a breast cancer patient? Are you looking for a place to do your checkup? So now you got an opportunity either visit the Hope for Women or Wellness Partners, Congaton, so that you can have your free check, absolutely free. You're not going to pay on them. And if possible, they also have a mammogram there, right? You can also do the mammogram check if you're above 40 or maybe younger and you have breast cancer risk factors. So they are also doing all of these tests free of charge. Is there anything you want to tell the public that we didn't talk about?
We cannot state this enough. Prevention is better than cure.
Absolutely.
So be aware. You have the opportunity for something that is free that normally will cost you at least $45, maybe even $50 to get a mammogram and things of that nature. You have the opportunity to do it for free. Take advantage of it. I cannot stress this enough. Men and women, come and take advantage of it. The sooner, the better.
Dara Smith, are you still there?
Yes, I'm here.
Okay, can we just get your closing statement and your advice to the public?
Just want to remind people that this free screening program ends on October 31st.
1 minute, we have a call. Good morning, Yanime, where are you calling from?
Hello?
Good morning, Yanime, where are you calling from?
Sorry.
What happened?
Sorry.
So you can keep your call coming in 0770-107-086-107-107. Dada Smith.
Yes.
Hello, Dada Smith. Okay, now go ahead, please.
Yeah, I'm here. Hello?
Yeah. Your party coming and
No,
advice for those that honor your birth this morning.
no, just encouraging people to take advantage of the free screening program for breast cancer and to remember that it ends on October 31st. So please don't wait until November, December next year. We realize that breast cancer happens every month of the year, but we also have limited resources. So the screening program is in the month of October. So
Okay.
please take advantage of it this month.
All right. Thank you so much. So let us move to Ness Johnson. Ness Johnson, can we get your closing statement and maybe any advice you got for the public? 1 minute, we're gonna call. Good morning, your name and where are you calling from? Good morning, you're live. I have any for the connection this morning. Don't worry, Ness Johnson.
My advice here to the public is that the people should please come for their testing.
Sure.
The earlier detection, the better you get cured. If you allow the cancer to stay in the body and it gets bigger, it starts to make so. You come to the hospital, it's at a late stage. The Liberian people always taking the cancer business to be like a wish. It's not a wish. My people out there, it's not a wish. Cancer is not a wish. It's a disease and it's curable. When you come sooner, the doctor will check you and you'll be healthy and will give your treatment to you. So please come. As both for women, you go to Jamali, you go to JFK, you go to Cali. Once you have problem with your breast, please make your way at the hospital. Do not sit there and say it's a wish and you start going to churches and going to herbalists for cure. So it's better you come to the hospital to get tested.
Absolutely. Early detection save lives. So you have to make your way there free of charge. Absolutely free of charge. So basically, can we get your closing statement and your advice to the public?
I think one thing we already stressed the fact that it's free, so come in. But part of this is awareness, so it teaches you. So even if you come in now, you will have the education that will stay with you forever to continue to do your own breast exams, and that for you to actually teach other people how to do it. So this is something that will, we're saying awareness is breast cancer awareness is in October. But if you come and get this education as well as this exam, it will be something that can save your life or somebody that you know throughout the years to come.
Sure.
So please take advantage of it.
Definitely. All right, folks. Thank you ever so much for being with us today. We want to say a very big thank you to our studio guests for being in studio and educating us on this life-saving information platform. Thank you ever so much, Dr. Smith, for joining us via WhatsApp to be part of this all-important discussion. We want to say thank you to Ness Johnson for your efforts in carrying on awareness in the various communities and also doing a free test from Hope for Women. Thank you ever so much. It's an honor and pleasure to have you here. Ms. Buchanan, to be on our platform. Thank you ever so much for your great services. Random to Liberia, we truly appreciate your effort and thank you for being with us today on Health Talk, Vital Health Talk. Thank you ever so much. All right, folks, unfortunately, this is how we come to the end of today's edition on Vital Health Talk. You can join us again next week, same time, same studio, on another fascinating topic when it comes to health issues in our community. And please share your view with us in the comment section. Do not forget to subscribe to our YouTube channel, Vital Health Talk, and please follow our Facebook page, Vital Health. We would like to say thank you to each and every one of you that tried calling and your company come true. Thank you to those that are following us on our Facebook Live. Thank you to the Hot FM family. This show is proudly sponsored by Honorable DJ Blue. We want to say thank you to Honorable DJ Blue for allotting us time in studio to always discuss health issues that are affecting us in our respective community. Thank you so much, Honorable. Let me leave you with this. Now, with breast cancer awareness and early detection can really save lives. So it is always important to stay informed, know the right information, and of course, know your body, know how to do the test on yourself. I am Mama Eluman. Thank you for joining us and see you next week. Thank you.